Hi, I'm Amanda Langseter. Welcome to Sullivan 180 Presents Take 5. Our guest today is Haley Motola, epidemiologist for Sullivan County Public Health Services. Welcome, Haley, and thank you so much for being here today.
Thank you so much for having me.
Can you please share a little bit more about yourself and what exactly does it mean to be an epidemiologist?
So I'm Haley. I've lived in the area for about a year and a half now. Being an epidemiologist is really interesting. The discipline is kind of all over the place. I think the basics of it is the who, what, when, where, why, and how of infectious and chronic disease. So it's kind of like investigative work. You know, you're looking for patterns, you're looking for, frequency and distribution, different determinants of health in the population. In a public health setting, we look at a kind of like a community level approach. Epidemiologists can be employed in pharmaceutical companies, in research facilities, in academia, and also in local, state, and federal health departments. So it's a little bit of everything. It's like looking at the individual investigation and then, kind of looking at the bigger picture then. So you start small, you get larger, you look for patterns, you look at areas that need outreach and attention. Literally, if you're looking at it geographically or not, if you're looking at it, if you're, basing it on demographics or age or sex or things like that.
So what programs do you actually oversee at Sullivan County Public Health?
So in the epidemiology department, there's we look at lead, we look at rabies, we look at vaccine preventable diseases, immunization programs. We have, we did measles. we do a little bit of everything. Any reportable communicable diseases, STIs, are a big thing that we handle. But of course, COVID-19 right now. So any new emerging novel diseases, of course, we deal with that too. And influenza, the flu clinics, rabies clinics, all that good stuff.
I probably know the answer to this question, but what is the biggest priority for your department right now?
Right now, it's definitely slowing the spread, which I know everybody has heard a billion times, but it is our goal is to slow the spread of COVID-19 as much as possible in order to not overwhelm our healthcare system.
Absolutely. And we here at Sullivan 180, as I told you, we're ready to support in whatever way we can to get the word out and the education out into the community. If somebody wanted to learn more about your department specifically and its services, how would they go about it?
So you can go to the Sullivan County government website, just type in Sullivan County, New York. And if you want to learn more about coronavirus specifically, there's a big yellow bar across the screen. You just click on that. That goes to our dashboard that has, every single weekday it's updated with, the number of active cases, people who are on isolation, quarantine, deaths, hospitalizations, people who are ventilated, as well as broken down by zip code. If you actually click on the little zip code, that's updated every couple days. Because there's just such an influx right now. It's not as frequently, but the overall, dashboard is updated every day, unless something crazy happens technologically or otherwise. But you can also go to the overall page for public health services. You just go by department, click public health services, and it'll bring you to a page with more information about, the resources that we offer and the different programs that we have.
Anything else that you'd like to share at all about what you do at public health and what's happening now in the world?
Well, definitely. It's the same old song and dance. It's, social distancing is huge. It's tough right now. I realize that people want to see their families. They want to see their loved ones during the holidays, but it's so important to socially distant, wear your mask. Masks work. They work because the virus is transmitted primarily through the larger moisture droplets that if you laugh or you cough or you talk loudly, are expelled through your mouth. And the fabric, cloth masks capture those larger, they're not going to filter out the little individual viral particles. They're traveling in a larger droplet of moisture from your mouth. So it captures what it's traveling in. And that's how a mask works. So wearing your mask is vitally important. And washing your hands, using hand sanitizer, also incredibly important. Keeping healthy, keeping safe. Everything that everyone's been doing for the past 9 months, but keep going.
Absolutely. So if somebody was going to a holiday celebration and with their family, they shouldn't feel ridiculous wearing a mask, right?
No, not at all. Well, it's the new cool thing to do. Wear festive mask with decorations.
They've got them in all sorts of very trendy prints, and we have our own from Sullivan 180. I wish I had one handy because I'd show it to you. They're beautiful. We give them out at Peace, Love, and Lights too. So if you get the chance to join us out at Peace, Love, and Lights for Walkthrough Wednesdays, it's the event at Bethel Woods where you can see all the lights, and we're almost to 500 Sullivan County people walking 1 mile at Peace, Love, and Lights. So
that's awesome. So good to hear.
Absolutely. Well, thank you so much for joining us today, Haley. Really appreciate it. And so looking forward to partnering with you and working closely with public health as we continue to slow the spread and work on public health issues now and into the future. Thank you, Haley.
Absolutely. Thank you so much for having me.